Hello, and thank you for joining us today. I'm Caitlin Miller, and I'm excited to welcome you all to this next installment of CTIA's Building the 5G Economy webinar series for a timely conversation about 5G connected health systems and the future of patient care. The last 2 years, we have witnessed how the pandemic has put an unprecedented strain on our healthcare systems. And even prior to the outbreak of COVID, healthcare inequity existed across this country, as it still does today. We have seen how innovative solutions can help address these challenges and break down barriers that inhibit access to quality care. Wireless networks and the licensed spectrum they depend on are key to creating this access today and in the future. With nationwide 5G connectivity, we have the technical capabilities to advance and scale next-generation innovation, particularly to reach underserved communities. From telehealth and immersive AR experiences to remote surgery and beyond, 5G will transform medical services and patient care as we know it, closing the healthcare equity divide, generating billions of dollars in healthcare cost savings per year, and promoting greater sustainability through telehealth. That's more than just hype. It's already happening today. For example, the VA Palo Alto healthcare system, one of the first 5G connected hospitals in the country, is exploring a 5G-enabled augmented reality surgical navigation system to enhance veterans' care. We'll hear about that project and more later in the program when CTIA's Nick Ludlum sits down with Dr. Thomas Osborne, Director of the National Center for Collaborative Healthcare Innovation at the Department of Veterans Affairs. But first, let's turn to our panel. Hi again, I'm Caitlin Miller, Manager of Public Affairs at CTIA, and I'm excited to be joined today by two experts who are working at the intersection of 5G and healthcare to connect the Internet of Medical Things. Let me introduce Clara Husted. Clara is the Assistant Vice President, Industry Solutions Channel Marketing at AT&T Business, where she leads the development of marketing strategy for AT&T's Industry Solutions organization, including supporting 285 healthcare sector customers. Welcome, Clara. And Cherry Drulis. Cherry is the Healthcare Director at T-Mobile for Business, where she applies her experience in frontline care, medical product development, and hospital management to help connect healthcare challenges to T-Mobile-powered solutions. Welcome, Cherry. I'm really looking forward to exploring this topic with both of you today. And before we dive into the world of 5G-enabled healthcare and the Internet of Medical Things, let's start today's conversation with the foundation of connectivity and the importance of 5G's capabilities. Clara, if we can start with you, during the pandemic, we have seen a significant increase in telehealth appointments and doctors and patients connecting virtually. So what is it that we can do with 5G that we couldn't do with 4G in terms of expanding telehealth and remote care beyond the technologies that we have seen emerge during the pandemic?
Well, so without a doubt, I think remote care is definitely here to stay. Healthcare is moving beyond the four walls to everywhere. And that requires secure, reliable connectivity. And what 5G does is provide that ultra low latency, better throughput, super fast speeds, which will help with the massive IoT connectivity as more healthcare providers are turning to remote patient monitoring devices. In the last year alone, we've worked with a numerous number of healthcare companies to enable a lot of those. So we're starting to see under the mattress sensors to kind of passively collect a lot of those vital signs, sleep movements, different movement data that you need as a provider to be able to care for the holistic nature of your patient. We also connected one of the first devices that measures your oxygen saturation, which I think in the pandemic we all realized, and I'm thinking everyone purchased one of those $18 oximeters just in case something happened. And the ease of use of these is incredibly important when people open them out of the box. When you purchase a cell phone, it just works. You get it, you activate it, everyone knows how it goes. When you send these devices home with the patient and they have to tether to an iPad or tether to a Bluetooth, another Bluetooth device, or do something like that, just adds a whole level of complexity that I think we can simplify in the cellular world.
And Cherry, following up on that and talking a little bit more about the connectivity, what do 5G's faster speeds, lower latency, higher throughput mean in terms of connecting the Internet of Medical Things and this next generation of healthcare?
Yeah, it's going to have a big impact on it. The use of the Internet of Medical Things technology is on the rise, and we're seeing more and more devices that need to be connected to the network, which can actually overload or slow the network down. So thinking beyond just connectivity, these devices can also produce large amounts of data, and that data has to be managed. So this is where 5G comes into play, providing that increased capacity to handle all the connected devices and providing that decreased latency and increased speeds to ensure that the data is being transmitted as needed, right? Because what we're going to be doing on the back end is using that data in real time to glean insights that then are translated into meaningful actions. And the benefits here are tremendous. For example, when you think about connecting disparate sources of raw data that has improved clinical insights. So when you're looking at 5G, that decreased latency, connecting all of those disparate sources, it gives that end user the ability to analyze that data in real time to help improve not only clinical outcomes, but improve and get to a diagnosis faster to ensure that that patient is on the right treatment plan early. Also when you think about the capabilities, hospitals can segregate patient health information using things such as your private 5G networks, which offers advantages in security, reliability, and spectrum efficiency. And when you take it beyond that, you have edge computing, referring to the computing that is done near that source of data. And this provides hospitals the benefit of faster, more efficient and more secure data storage and processing. And from a clinician's perspective, this is critically important, especially when you're thinking about all the data that is being collected through the Internet of Medical Things technology and devices. And then when you look at all that data, take it to the bigger picture, and you look at all of the pieces and parts, the new technologies, 5G and edge computing, and when all of this comes together, it's making healthcare more connected, more secure and efficient, which is greatly improving the source of healthcare delivery, especially when you take it beyond that brick and mortar into what we call click and mortar and think about your rural areas and your underserved populations.
That's a great segue. And I know both of your companies are working every day on 5G-enabled solutions that are helping to shape the future of healthcare. Cherry, can you tell us about some of the exciting healthcare use cases that you're seeing come to life today over T-Mobile 5G network?
Yeah, before I do that, though, Caitlin, I think it's important, and I want to take a minute just to talk about how I personally feel 5G is enabled solutions is shaping the future of healthcare, and then I'll cover a few of the use cases that I'm personally working on right now. So when you think about the new era of healthcare delivery, reliable connectivity, security, and innovative networking solutions are more important than ever. And that's why 5G makes all the difference. Your 5G networks bring that fast, reliable, and affordable internet and wireless services to small towns across the country, making an impact on the digital divide and health equity. That's something I'm very, very passionate about. And when you compare it to its predecessors, 5G offers considerable advantages that we have already touched on. And I know Clara touched on those as well. And that's that low latency, that higher bandwidth, and the ability to support more devices. And the increased capacity, which is important, what we just talked about, the Internet of Medical Things technologies. So at the same time, the healthcare industry is undergoing a transformation driven by the rise of telehealth and the evolution of the Internet of Medical Things. And these developments are accelerating the capabilities of telehealth. So when you take that into consideration and think about all of the different use cases, some of the things that we're working on 5G, our T-Mobile 5G network, specifically around radiology use cases. We all know that imaging files are extremely large. Sometimes they can consist up to thousands of images just from one study. So when a network's bandwidth is limited, this creates that lag or latency that can potentially cause a misread, a backlog, or delayed diagnosis. And we know how critical it is to get to a diagnosis to ensure that you're on the proper treatment path. So leveraging 5G networks, you have the ability to eliminate that lag or latency, enabling the transfers of these large data sets. And right now, we are currently working with a large organization where we're leveraging our 5G network along with multi-access edge computing to transfer these large data sets, these imaging files, that DICOM data in real time. And then we're applying AI to help facilitate workflows and efficiencies to provide that better care in improving the speed of transfer and dissemination of that data. You know, another area that we're working on, I'm an old school certified level 1 trauma nurse and implemented my first telehealth program probably about 18 years ago. And one of the things that we're working on right now is the 5G equipped rig for first responders. I'm really big on taking the pull methodology of healthcare and turning into that push methodology and taking things to the patient at the point of interaction. So we're putting diagnostics on rigs to do screenings of the brain to rule out hemorrhagic versus ischemic strokes in order to potentially administer TPA in the field to reduce the site of injury to the brain. Another thing that I'm working on is truly expanding telemedicine or telehealth to rural America. A really big, like I said, passion of mine is addressing the digital divide to improve access to care, to make an impact on health equity, and truly ensure that all people have access to health care when they need it. We're working with a lot of organizations to implement telehealth programs, hospital-to-home initiatives, those EICUs in the rural America. Another example I'll touch on really quick is enhancing your AR, VR technology. You know, that technology already exists today, but with 5G, we have the ability to provide that bandwidth and decrease latency for that better experience. And we worked with Fisk University to create a virtual human cadaver lab. You know, human cadavers are very expensive for medical students and they have limited access to those human cadavers. So we worked to create a virtual cadaver lab powered by our 5G network, which allows a student to, if they need to dissect a heart more than once, they have the ability to do that. And it has a really extreme of photorealistic details and interactivity. So we're doing a lot of work around that.
Yeah, those are great examples. And Clara, same question to you. Would love to hear about some of the exciting healthcare use cases that AT&T is working on.
Yeah, I love sharing the stories of how we're partnering with different individuals and different organizations. And I think for me, how 5G is changing patient care is best to talk about those entities. So we're partnering with the Lawrence J. Ellison Institute for Transformative Medicine out in California, and they have smart technologies integrated throughout to truly connect and an immersive collaborative environment for patients and researchers. We've installed an on-site private 5G network that has multi-edge computing attached to it, along with some other cutting-edge technologies that unfortunately I can't share. But we're helping the Institute reimagine the connectivity within healthcare and enhance the patient experience within the clinic. So just a couple of things. They have sensors that are allowing the Institute to track how much interaction is taking place between patients and staff. The data, in turn, can help the Institute improve the process that a patient experiences. Additionally, just like was mentioned previously, files are incredibly large to transfer, but it's important to know that doctors aren't always on site. So having that nomadic care of where a device leaving the institute can still access some of that patient data as long as the IMEI code matches something that they can choose to access. They're also capable of providing anticipatory, personalized, high-touch patient care based on the knowledge of what type of music to play, lighting during a patient's appointment. They dedicate bandwidth to certain areas of the private network that make it possible for the Institute to connect more devices wirelessly, and through that MEC, determine which applications they will provide the highest priority of service on there. So from IoT equipment to sensors to handheld devices, all the way to those large data files for 3D tumor imagery. The other neat thing is with that slicing, they can then say, hey, for those who are connecting with us as patient guests or more for entertainment purposes, you can put them on a separate segment of that bandwidth that allows them to access that in a different way, away from what the Institute is actually using it. Another favorite partner of mine is Artisite. They're doing smart telemonitoring, and it's another example of how 5G can play a role in improving patient care in a clinical setting. The Artisite solution uses computer vision, so think of it as a camera as a sensor, and their technology and smart cameras run over 5G to provide a digital window into patient rooms, and having that camera at the nurse's station to allow them to view into each of the individual rooms, reducing the need to do a lot of different rounds, especially just to check for fall prevention. The other really neat thing that the telemonitoring solution can provide is in the OR room, so they can track all of the different tools and medical devices that are used for a surgery. And my husband actually had a patellar ligament surgery this fall, and I had no idea the amount of devices. I asked to get to watch the surgery, and they would not let me, but I got to see into the room and what technology they were using in there. But there are so many different medical tools I think the layperson doesn't understand. And in order to keep track of them, having a camera completely focused on that tray and making sure that sponges get returned to the tray and that nothing gets sewn up. So it can help with making sure that surgeries are efficient. It monitors the timeouts that happen in those facilities. And then lastly, you make more efficient use of the OR based on the ability to time each of those doctors and the surgeries that they do, so you don't have a large wait time. It also helps with training. And so the data that you're getting back from those 5G solutions is really important and imperative for being the most efficient you possibly can in a hospital.
That's incredible. And, I want to expand on a couple points that you both made as you were bringing up some of these interesting use cases, because as you both were talking, it actually made me think a little bit about my own experience growing up in a small rural town that had a clinic, but the closest specialized care was well over an hour away. And as you both know and alluded to, there's communities all over this country that may not have easy access to healthcare, or there may be staffing shortages or other challenges. So I just want to kind of connect the dots back to why these use cases are so important. And how do you anticipate 5G will help solve the healthcare challenges our communities and health systems are facing, maybe particularly for traditionally underserved communities? Clara, do you want to start us off on this one?
Yeah, this is something that I'm personally really passionate about as well, because I grew up in McAllen, Texas. And although there are a ton of hospitals, they're mostly dedicated to heart facilities because a lot of people are eating fast food down there. But this is something where, again, we've partnered with some amazing individuals. One of them, Nurse Interrupted, and they're putting a lot of tablets in to places where you would normally be able to go to if you were an underserved person, libraries, schools, we're looking into different retail locations and taking up a piece of their space. But having nurses remote into these locations via a tablet has been incredibly helpful for them, and doing it over the mobile network rather than an infrastructure network, which sometimes isn't there. But the other piece of it is our Firstnet platform, which for those who might not be familiar with it, during the 9/11 commissions, it was determined that it was incredibly difficult for our first responders to speak to each other. And so our government pulled out a band of spectrum, band 14, and dedicated it entirely just to first responders, EMTs, and now our medical community. And this spectrum is incredibly important. It's owned by the government. It's operated by AT&T, and that's why it's called Firstnet. It's not AT&T Firstnet, just Firstnet, operated by the Firstnet Authority. But what it does is during a mass casualty situation, an emergency situation, all of those first responders get priority and preemption, and anyone else on the network gets pushed down to make sure that you can talk through that event from first responder all the way until they reach your OR. And the beautiful thing about that is the government dictated where the locations would be. And a lot of them are in rural communities where we have that connectivity. And we're partnering with multiple RPM solutions to make sure that they're on our FirstNet network, not necessarily our AT&T network, so that they can tack onto those poles and spectrum where we had to build out to meet those government guidelines. So it's a really special platform for us, and something that's very important to AT&T and our first responder community.
You know, one of the things that I think people assume and don't realize is that we have that need in the urban area as well. So it's not just a rural area. And one of the things that I always like to say with T-Mobile's 5G network, I was recruited from over at IBM, where I played in artificial intelligence, machine learning, and literally covered the entire world. And the thing that I was always passionate about was democratization of healthcare. And the way T-Mobile has built and deployed our 5G network to truly cover rural America, that was the compelling event for me to come join T-Mobile and lead the healthcare journey with T-Mobile. And when you think about that, many rural areas, and even your urban areas, do not have access to basic broadband, right? So they can't even participate or support activities that are vital for just work, school, or even healthcare. So when you think about how 5G can impact that, I always say there's two paths moving forward. One is definitely advancing emerging technologies where you need that decreased latency, speed. But the other is coverage, covering those rural areas to ensure that everyone has access and truly working on health equity. So that's, I think, critical when you think about how 5G is going to help address those particular challenges that we're seeing within the healthcare industry. And then when you think about that, so what type of technologies, we talked about that earlier, can we put in combination with that network to ensure that you are providing that access or that care, like you were saying, you live in a rural area where you may not have a subspecialist, but you have a primary care physician. I'm personally working with some retailers right now where we're looking at deploying telehealth kiosks with medication dispensing systems. So in those areas that are underserved, whether they're rural or urban, that do not have access to a provider or a pharmacy, we're going to leverage our 5G network to ensure that they have access. I'm working with a couple of large academic medical colleges right now as well. And you think that's not rural, that's your urban area, but we are looking at deploying these telehealth kiosks on campus to ensure that students and faculty have access to healthcare. And when you think about it in a rural area as well, and you touched on that, there's distance. So when you're challenged with our economy today, the price of gas, and when you're in that, most of these individuals in the rural areas are farmers, so they don't actually have the means for transportation to drive 60 plus miles to seek medical treatment. So how can we help them by leveraging technologies and 5G to improve that access? And that's what we're doing over here at T-Mobile, and it's something that we're very passionate about. And knowing that when we lay our heads down at night, we're truly making a difference on the overall population of communities and keeping them viable, which is important, keeping the individuals healthy in community so they are viable.
That's a great segue, because I think another important part of this topic and a topic or point of it that's so valuable is that the impact of 5G will reach beyond our health systems and really kind of come back into our homes, reaching us wherever we are, whether it's telehealth or wearable devices or assistive technologies, there's just a lot out there. So a question for you both, how can the increase in 5G enabled devices help improve the health and vitality of individuals and communities beyond our doctor's office? How can it really empower us as individuals?
I think number one, it gives patients better access to their healthcare teams. Since RPM devices support real-time health data, practitioners can be kept in the loop with their health status, whether it's a chronic condition or a new condition or a post-surgical condition. It also means fewer trips to the doctor's office. I was actually at a provider's facility, and they said the number one entry into their ED was dehydration. And if you could keep somebody out of the ED, it means less exposure to other illnesses, and then fewer expenditures in both time and money for travel. And then not to mention, when you send all of those bills over to your payer, what kind of issues that pops up. And then I think we've all reached this, and I think the pandemic has driven it even further, but you want more control over your own personal health. And those RPM devices can really provide patients with that real-time data for themselves, whether it's something that's under the mattress and giving them, I would say the peace of mind that they can go to sleep and not stop breathing in some cases. Or if it's just the Cora ring that I think every celebrity is talking about right now. And 5G outside of a facility, when you reach Wi-Fi, about 10,000 devices and you reach saturation, but that's in an enterprise space. When you're at home, how much TV time is taking down your network? And so you're going to start needing more bandwidth at home, and offshooting that to mobile is really something that you can benefit from. I think the last piece of it, and this just came to mind in thinking about my parents, but just aging in place. You want to keep track of your family members. And we have a watch, Navigil, that we partner with. It looks like a regular old watch, but it sends those health markers to not just your provider, but also to your family if they choose to opt in. And, 75% of adults over 50 in this country have a need for that, and they need to age in place. So I think connected care means a better future for them and a better future for their families, so they're not so alone. And I think hopefully it'll also remind us that we need to call our parents more often.
And when I think about it, I think about, making healthcare accessible to everyone. And that's where my mind goes when you ask that question, making it accessible so that people can own their healthcare. And that's what you just touched on as well, which I think was spot on. Again, it's addressing that digital divide and improving health equity. It also helps address those social determinants of health that keep individuals from seeking healthcare. It allows you to take care of populations from that holistic perspective and keeping them healthy in their homes, kind of like you were just talking about aging at home, right? Or aging in your home. And then that early identification of physiological decline, right? You don't want those increased episodes of care to your emergency room, because that's what drives up cost of care. And we always have to keep the triple aim of healthcare top of mind when we're thinking about how we're going to address healthcare in the rural and urban areas. And then that also, you're able to provide better chronic disease management, being able to do enhanced decision making for those for those patients, leveraging RPM capabilities, being able to be reactive instead of responsive to those physiological changes. And then also, just reducing the cost of care by preventing complications or exacerbation of those chronic diseases and being ahead of the curve and instead of behind it and being reactive. So that's where I think 5G enabled devices is going to help improve overall populations or individuals and communities.
That's a great point. And if we could actually go from there and kind of take a look at the bigger picture of what this 5G decade will mean for the future of healthcare, I think really getting these solutions out to patients, out to healthcare providers is going to be really important. And just wondering if you can speak to how some of these partnerships that you mentioned between wireless and healthcare industries are helping advance 5G adoption by both consumers and patient care providers.
Yeah, so I'm going to speak to what we're doing right now with telehealth. We have a partner that we go to market with called Zyder. And we leverage our telehealth platform. It's an OpenStack API modular approach. So what we do, I am one of 5, and I lead our healthcare team over at T-Mobile. All of my staff are clinicians. We all have at least 20 plus years experience in the industry, with covers the whole spectrum. So what we do is we always do a consultative approach to our clients. We go in and we become our client. We listen to our client. We learn. So we really are really big on creating that trust and that partnership, right? We want to embark on a journey with our partners. We don't want to just go in and sell a device or a data plan. So it's really important that you have that strong partnership between your carriers, your healthcare industries, and your device companies. We work as a collaboration. We're very open, and we consider ourselves a part of their team. So when we're working with our clients, we listen, we figure out what the use case is, and we solution that use case, whether we're looking at addressing the digital divide and improving access in the rural area, or looking at our urban areas and trying to figure out how to create Zen gardens so that you can go and rest and recharge. Or if you don't have access to Wi-Fi, you can go to a Zen garden where you're in like the urban area, or what we call, a concrete desert or a digital desert. So I think when you look at the big picture, it's really important to have that trust and that really comprehensive partner ecosystem, because that's where you're going to bring the most value to the industry.
I would echo that, and then just also add to it is the adoption piece of it is almost in the ease of use, and people not even knowing that it's connected to, a cellular versus Bluetooth versus Zigbee versus whatever network. And I like to use, for example, we worked with Hanger Prosthetics to create a prototype for the first LTE-M connected prosthetic device. And I can tell you, anyone who uses a Hanger prosthetic doesn't say like, oh, it's connected to AT&T. They might know that, and that would be wonderful, but they just know that all of their data is being sent to their physician and to Hanger Prosthetics so that they know that it works in the usage. So the adoption really, it becomes the ease of use and the benefit that you're seeing as a result of it. We also worked with another company, Accelerated Care Plus, to improve outcomes for physical therapy patients. It was an app on an interconnected cloud platform where we could tell if individuals were actually adhering to what their PT physicians had told them that they needed to do. And I think the people who used the app versus those who didn't really saw better outcomes in their healing and help. And I'll say probably the one that I think really stole my heart was our partnership with Vitas, which is an end-of-life facility. And what they did was, in these individuals experiencing massive amounts of pain, they used AR, VR, and created these really neat experiences for them where they could walk Machu Picchu on the Oculus lens, or I think some people brought their own, but it was on the 5G platform. And when they tested them to say, what's your pain level at? A lot of them have 8 to 9 on a daily basis, and they don't want to be on morphine. They don't want to be on drugs that don't allow them to be with their families. And this brought them down to like 5s and 4s, which I thought was really impressive, just getting those endorphins up in a really powerful way. And that was something that I hope to use at the end of my life someday.
And maybe just a follow up to that, because, these are some great examples, and want to make sure, as an industry, that we are getting this to every community, every corner of the country, right? And so how is it that we can scale these 5G healthcare solutions to really benefit patients and patient care in this country?
Claire just touched on that, right? Scalability depends on adoption. So it's the way you implement and scale. It really is going to depend on the readiness of the end user and the adoption of that technology. So when you think about adoption of new technology, there's always that adoption curve. You're going to have your early adopters and you're going to have your laggers, right? So it's really having those use cases that that we've talked about, those proof points and showing the impact that 5G is going to have on healthcare. And Claire, you were talking about your ocular, and it made me think of, how powerful partnerships are. And I'm going to digress here just a minute, but one of my ISAs is active military, and he was currently deployed in Iraq. He is a PA, and he was frontline. And PTSD is a big issue when you're in active war, right? So they were over there, and we have a partner called Helium, and Helium provides virtual reality, mindful meditation, full immersion for anxiety, addiction, and pain. And when I learned that he was being deployed, the first thing I did was I called the president of Helium, Sarah Hill, and I was like, Sarah, I have an employee that's being deployed. Are there any way I can send some of your kits to the front line? Without hesitation, she sent us 2 of those units, and we sent them to the front line, and they've been using them every day on soldiers. And it has been decreasing their psychotic break episodes. And we're starting to see some really good data come from that we hopefully are going to be turning into a white paper here really soon. But it's allowing the soldiers to stay in place and provide that access and placement instead of having to be shipped back to the state sides for our treatment. So again, stories like that showing the power that the 5G and technology can bring to the end users is going to help with scalability. But you have to keep in mind that when you implement technologies such as, your 5G technologies, it has to be on a platform that is scalable, fluid, and can be responsive to the ever-changing landscape that we practice in every day.
I would definitely agree. I think the adoption is incredibly important. I also think that getting the whole ecosystem to participate, so not just the providers who are prescribing these RPM devices, but digital therapeutics was just a thing that was added this year as something that you can then charge and bill for, and your payer would then pay. So making sure that the payers see the value. And I think with the acquisition we've seen of several RPM devices by payers, I'm jokingly calling them payviders now, but they're starting to see that value. And I think the usage of it and making sure that the pharmaceutical companies and the med dev companies are also seeing the value and not adding, I think, any cellular connectivity to your roadmap is kind of a miss. And you want to make sure that your devices are easy to use to help with that adoption. But if everyone's not playing in the same game, you're kind of missing out on little chinks in the armor there, which you really need to cover.
I wish we could keep this conversation going all day because I think there's just so much to cover here, and you guys have provided so many valuable examples of why we really do need 5G connected healthcare. But maybe a good final note to leave our audience with, and a question for you both. As we build the 5G economy over the next decade, what possibilities are you most excited about for 5G enabled healthcare?
So when I think about the future that 5G is going to enable, and what I get most excited about is the emerging technology aspect that it's going to bring. Not saying that what we've taught throughout the whole conversation today isn't, but this to me is the exciting part that 5G is going to enable, and how 5G is going to change the way we provide healthcare to our patients. One of the things that we're doing that I get really excited about is we're working, for example, with a neurosurgeon right now who removes blood clots from brains once the patient is outside that inclusion window for TPA, the medication that dissolves the clot in the brain to decrease the sequela of a stroke event. So we're working to figure out how we can leverage our 5G network, creating that private 5G network within the OR to remove that surgeon from the room. We're initially going to do like a tethered control room for the neurosurgeon to remove the clot from the brain. And then the evolution of that is having that surgeon remotely wherever he may be physically located to remove a clot from an individual that may be hundreds of miles away that wouldn't have access to that subspecialist. So those are the things that I get really excited about when I think about the future of 5G and how we're going to change the way we provide care to our patients.
I think for me, the future of healthcare, I'm not as scared to be a patient anymore. Most recently gave birth in 2018, and I think we were using some of the same technology of when my mother gave birth to me. And that was a little scary. And so seeing the patient room of the future and the different applications and the technology that, my kids will then get to see is really exciting. I also think video as a sensor is going to be a huge game changer. It seems awkward and scary to me right now that you would leave somebody alone in a room after they've had, a massive, surgical event or things like that. And I know people are really worried about privacy and HIPAA, but there are a lot of people who've died with their privacy intact. And I think that there is a way that we can be a participant in flexing and changing and augmenting some of those rules as they hit the future, which is where we're all living. And I think the upside of this pandemic is that it brought us an ability to start talking about these things in a different way. And we don't have to do things the same old way that we used to. I think 5G is just one technology that's going to enable a world of others. And I'm really excited for AT&T to play a part in that.
Well, I'm really excited to continue to follow the work that both you and your companies are doing to advance 5G-enabled healthcare solutions and the work you're doing in this space. I'm sure our audience is as well. Clara and Cherry, I cannot thank you both enough for joining CTIA today. Thank you.
Thank you. It was nice meeting y'all.
Yeah, thank you. It was a pleasure.
Hi. My name is Nick Ludlum. I'm Senior Vice President of Communications at CTIA. I'm pleased to be joined today by Dr. Thomas Osborne, the Director of the National Center for Collaborative Healthcare Innovation and Chief Medical Informatics Officer at VA Palo Alto Healthcare System. Dr. Osborne, thank you for joining us today.
Pleasure to be here. Thank you so much.
So I'm really excited to have this conversation because it sounds like you're doing some really interesting things there. And I wonder if you could tell us a little bit about the healthcare system, the Palo Alto healthcare system, and some of your work as one of the first 5G connected hospitals in the country.
VA Palo Alto healthcare system is part of a larger healthcare system, obviously. So the VA, the largest integrated healthcare system in the United States, has many healthcare systems within it, VA Palo Alto being a large facility in that matrix. So VA Palo Alto is 3 hospitals and 7 outpatient clinics. We're in Silicon Valley, and within that large area and on our main campus is where our national center team is based. And our team, our goal, our purpose, our mission is to bring together diverse perspectives and tools and resources so that together we can build the healthcare system in the future. And so, I guess in short, we believe that the diversity that we can catalyze with is a strategic advantage, and together we're going to achieve more. So, obviously, we are veteran-centric, and our goal is to provide the best, most advanced healthcare possible to our veterans, which we see as both an opportunity and a responsibility. So we do that in a lot of different ways, and we use a lot of different tools. But we are not focused on any particular tool. The tools are just ways to get to our purpose and our cause of delivering the best care possible.
So what role does 5G play in helping advance veteran care, and in particular, breaking down maybe some of those barriers to healthcare?
That's a good question. So our team is really about putting VA in the driver's seat of innovation and advanced healthcare. And, like I was saying, it's just all about providing the best, most advanced healthcare possible. And so 5G is one of those things that we have been looking at for some time, because we know that there are some things we can do better with that infrastructure. And there's other things that we suspect in the future we'll be able to do more with. And so it gives us not only the ability to do things now in ways that we've always wanted to do, but also gives us freedom to operate and to expand and to explore in ways that we couldn't before. So, 5G, the way I see the value in 5G for us is one of the big challenges we have in healthcare is, there is a tremendous amount of information. it's and quite frankly, that's really a huge benefit of where healthcare has gone. We're collecting a lot of information, digital information, but one of the things that we perhaps need to do better is to translate that information into information that's actionable, to knowledge and wisdom. And so that really requires a lot of additional resources, skills, and expertise. And one of the things we can do is have a system, an infrastructure that allows us to relay that information efficiently, so then we can use it in ways that we couldn't before. And one of the ways that we could, do that is to extract information from this data and allow us to make informed decisions that would improve care.
Well, that's really interesting. Now, I know that one of the particular challenges with veteran care is that many live in rural communities. Many may not be close to a facility. And when we know that rural communities, where there's still a digital divide in this country, it's still something that we're trying to address. So what role do you see in closing the digital divide and in using technologies such as 5G and helping to facilitate that patient care?
Yeah, thanks for asking that. That's a big issue and close to me as well. I was brought up in a rural community, and I've worked in rural communities, and our veteran population primarily lives in rural communities, and there intrinsically is disparity in that because of the distance there is between people who need care and the location of care. So, the VA has been doing a really amazing job with telehealth. And telehealth is one of those tools that can bridge that divide. And, in rural communities you can only have telehealth if you have some form of infrastructure to provide that, at a very basic level for synchronous, real-time telehealth. You could do that by phone, but most people recognize that using a phone is not adequate for delivering or diagnosing healthcare. And therefore, internet access is required for, even the more traditional telehealth tools, such as a teleconference, like, what we're doing now to some degree. So the availability of that internet, broadband, in its variety of forms, is quite variable and limited in rural communities. And sometimes it's not at all available. And so therefore, we really need to think about how we're going to make that infrastructure more robust at a baseline. Not even talking about 5G at this point, just baseline telehealth care. And that really needs to happen in order for us to start to provide care in a more democratic way, where people can have access to the same level of care regardless of where they're living, at least through a telehealth platform. Now, going the extra mile, 5G allows you to do more things in more interesting ways, perhaps, through that type of infrastructure. But I think basically we need a foundation where people can get basic level of care before we can start thinking about how we can make it more advanced with 5G.
Well, let's maybe take a quick step back and could you talk a little bit about how this project got started? How did you get started with using 5G? And maybe where are you on that journey now?
Like I said, we really lean forward for veteran care. And, also one of our hopes is that as we solve problems for veteran care, the largest integrated healthcare system in the United States, that the same things that we do here could potentially be, and likely will be, applicable to people outside of the VA throughout our country and perhaps even around the world. So that's really exciting for us. Now, we are agnostic to the tools we use and the collaborators that we work with. And our focus is really to work with people and tools that help us solve these problems where there's an aligned incentives and everyone is working towards the same goal of providing the best possible care for the people that we serve. And so 5G is one of those tools that we have in our arsenal. And so we're not, like I said, we're not exactly focused on 5G, but this is a a valued tool that allows us to do things that we couldn't do otherwise. So we saw this opportunity and the potential, and we started to talk and work with a bunch of other people who had complementary skills and resources. And that's sort of our wheelhouse. So we established a CRADA, which is a bit of an agreement, a cooperative research and development agreement, with a bunch of other people in this space who have similar ideas and tools. Now, everybody brings something different. Not any party doesn't bring everything. And so it's sort of like a Venn diagram. We have working on this project, Convergence, we're calling it, with Verizon. They bring the 5G. With Microsoft, they bring the HoloLens headset, which is a mixed reality headset that allows us to do really cool things. And we're also working with Microsoft, with Metavis, which is a software company that creates the software that allows us to do really interesting things in this mixed reality space. The types of things we're doing it's pretty fantastic. We're intentionally or not, we're sort of bringing science fiction to life. So we're doing things that most people say were not possible and couldn't be done. And it's really fun to see that happen.
Well, let's dive into that a little bit. So you talked about mixed reality and some other applications. What are some of those healthcare use cases, those 5G enabled use cases that you're working with now?
Yeah, great question. This is a fun topic. So the way we sort of, drawn out our roadmap is from relatively straightforward, still challenging, but relatively straightforward from a technical and regulatory compliance perspective into the more complex. So we sort of have this agile methodology to our approach. So the things that we've done and were done very early in our project is using this mixed reality, augmented reality system for really robust teaching and training. So I'll start a little bit with that. So imagine you're a med student or anybody who's trying to learn the basics of human anatomy and physiology. Most of the ways that we traditionally do it, including the way I did it, is you use textbooks and you're trying to understand the complexity of 3 dimensions and even 4 dimensions, not 3 dimensions in motion. So it's sort of like, calculus. You're trying to understand that in a 2-dimensional piece of paper. Very difficult to sort of understand that. And sometimes you don't even realize how difficult it is until you translate that into real world care. And you're like, that's not what I understood on the piece of paper. So we have the ability to make that 2-dimensional image on paper come to 3-dimensional life. And so we have, for example, an atlas, a very robust atlas of human anatomy that you can interact with. You can enlarge it the size of a 3-story building. You can walk into the heart and into the lungs, and you can see things and interact with things in ways you couldn't before. And the additional thing that's really amazing about that is other people can be in that virtual space with you and explore and share and teach and learn from each other, understand the relationships of arteries and veins and bones and how they all come together and how procedures need to be done in a way that is appropriate considering the roadmap that you have to work on, which is a very complex human body. And so that is certainly it's a wow factor, but it's also allows you to learn more and understand things that are really difficult, if not impossible, to convey in 2 dimensions. And so that allows people to not only learn better, but also learn faster. And now with that idea or philosophy or paradigm, you can then move on to other things. There's a tremendous amount of things to learn in healthcare, and that is just growing. So if we can make an important foundational chunk of it easier and faster to learn, then we can allow people to get trained more effectively, faster, and efficiently so they can do other things. So that's sort of where we started. And we're working on projects with nurses and med students and surgeons across the board. So a lot of really cool stuff. Then the other thing that's sort of in this same, well, there's a lot of things in this space. The other thing that's particularly cool is in addition to having this virtual atlas of human anatomy, which has many layers you can work with, we have the ability to take someone's own CT scan or MRI scan, and we can transform that from a two-dimensional image, which a radiologist like myself would look at, which is not intuitive to look at all. You can transform that into a three-dimensional rendering of somebody. So now it's much more intuitive for anybody to look at in healthcare specifically. And you can then interact with that with others who are trying to understand the problems that this patient is in front of them, trying to like adequately solve the medical issues in collaboration. And so then instead of working in these arbitrary sort of XYZ planes of looking through someone's anatomy, you can look at any plane. And so that is exceedingly exciting. But then you take it the next level, which we're doing right now, is you can take that three-dimensional image of someone's own anatomy and you can superimpose it upon their self, on their body. And at this point, you literally have three-dimensional X-ray vision. Like, you know, back of the comic books in the 50s, like this is like happening now. And so multiple people can come and work together. We've done this for pre-surgical planning, really difficult cases. We're able to understand and have better knowledge and understanding about the best approach about how to take care of people. So those are just some of the things that we're kind of starting with. If you want to move further down the line, there's something that we just did that I think is pretty cool. So imagine, if you will, Star Wars. You know, remember that time where R2-D2 came and he projected Princess Leia, and she said, "Obi-Wan, you're the only one who can help." So that hologram, right, of Princess Leia, that to me was like, geez, that's cool, but never happened. We've done that. We've done that in the lab. And in fact, not only was it that, but it was a little bit better because it wasn't a recording, it was real time. So I was on one side of a building, my friends were on the other side, colleagues, team members, and we were both able to see a three-dimensional virtual volumetric hologram of each other in different rooms. So we can superimpose each other's body there. So that's super cool if you're thinking about telehealth. But imagine, you know, the challenges we've been having with COVID, where people have been locked, sort of, you know, isolated within isolation rooms for their own health and everyone else's because of the virus. They have been in a situation where they can't interact with people unless they spend some time to put on the equivalent of a sterile spacesuit. So we can now have the possibility of transporting someone virtually into a room. So you can have a more human interaction with someone at the same time you're respecting the needs for infection control. And so those types of things I think are particularly exciting. Now you think about it like the next level, right? And so if you can do all that, which we can and we have, then you can also do this across the country, which we've also done. And so imagine like you're a surgeon and you want to teach one of your buddies like the latest technique because you're really successful with it. The only way to do that these days, you can't do it over a phone. You have to interact, and show people things. The only way you can do it these days is to get on a plane. Like nobody has time for that for every single time that they want to do something. But if you put on, the virtual headset, you have the ability for the bandwidth and you have the tools, you can do these things at a distance. Now, if you take it even further, like imagine you're in a rural community, right? This kind of goes back to the rural community. If you have the infrastructure, if you're lucky enough to have the infrastructure and you're living in a rural community and you're a surgeon or an ER doctor or anybody who's trying to take care of somebody and you are feeling like you would just love a consult, you're feeling a little bit out of, the limit of your knowledge. And geez, we all, are better when we can work with others and share, what we know. But if you are maybe a general surgeon and a kid is sick in front of you and you're trying to do your best and you're alone, wouldn't it be great if someone could be there with you? And if you're in a rural community, that's tough. But maybe You could put on a headset, use this infrastructure, these tools, and you have a friend at some big institution or friends that can get in and they see exactly what you're seeing and then give you a virtual overlay of exactly what it is you need to do as they're talking to you. I mean, this is the type of thing that has the potential to democratize care. So the type of care and knowledge that comes to your service is not dependent on where you live.
That's incredible. And this next question almost seems unfair, to ask, given the applications that you've already talked about seem so remarkable, and you mentioned sci-fi before, but I wonder if you could look 10 years out and think a little bit about and talk a little bit about as 5G becomes more ubiquitous, as these applications develop, as people like yourself have time to further innovate, what are some of the applications that you see, further down the road that could be really exciting?
Yeah, Nick, that's so cool to think about it. There's so many things. I mean, there's things that we can sort of foresee, but as we move forward, there's going to be more stuff that are going to surprise us even in this space. So that's a really fun question. It's hard to know when 5G will be ubiquitous. It's going to take time like anything else. However, as we drive toward that timeline, there are other really exciting tools that are also advancing in parallel. They aren't necessarily super robust to be as applicable today as we would hope, but I think in the very near future, they will likely be, and perhaps there'll be a convergence of these tools and 5G's availability at the same time. So some of those tools that I'm talking about are, okay, I'll start with the easy stuff, somewhat easy stuff. So edge computing, like we're actually doing this now. So edge computing is where you take information from one point and you bring it to something like a cloud server and you do advanced analytics on, and then you bring it back to the point that it started. So imagine in this case that you're an ER doctor taking care of somebody, and you are seeing a case that's really tricky and you're not sure what's going on. You can have all that information put into a system. You might have an AI algorithm that does advanced processing on that real time, takes information of the patient you have in front of you, their labs, their vitals, maybe genomics, radiology images, is able to bring them all together. And with advanced analytics, we could potentially come up with a list of options that may not necessarily be intuitively apparent at first glance. And so you could have that come back, you could have that information come together, be processed at a remote server, and come back to the point of care almost real time if you have this infrastructure and the tools. And then you can have point of care clinical decision support where you can get to the diagnosis faster and more effectively. Being able to do that, we know the faster you come up to the right diagnosis, the better care is going to be. So that, I think, is likely in the relatively near future, and that's something that's really on our radar. But then you go further, and so these are some of the things that I was thinking is a little bit further down the line to be practical, although certainly possible in the lab setting, is robotics and haptics. So, I mean, everyone knows robotics, but haptics is like having a way to feel things virtually, or to give you the sensation of feeling things that may not necessarily be there. So you think about the gloves that someone might have on, and they are virtually touching something, and there's pressure that they feel in their hands. So you have this sensation that it's really there. So instead of having the audio visual, which is a typical sort of AR or VR type of a scenario, you also have another sense, which is, sensation, which is touch. And so if you have haptics where you have biofeedback about what you're touching, then, and robotics, then you could potentially provide surgery at a distance, because now you sort of have the sensation where you feel different pressures, which is a very important part of surgery, to feel and to know what different things are like, not just what they look like, but what they feel like, but also have robotics that can work real time to do these things at a distance. And then that would also be very important for remote care, certainly in rural communities, but perhaps even countries that don't have the same level of access to care that we have in the United States. But also NASA. I mean, geez, we're talking about going to the moon, and you're not going to have an OR going up with you. So if someone has a problem, you would benefit from someone being able to tap into this type of technology so we can provide that care, so we have a successful mission. And that mission is important for NASA, but it's also an important mission for us, just to be able to provide the best care possible, regardless of where you're at.
Yeah, that sounds incredible. I think as a final question, Dr. Osborne, I wonder if we could go back. You talked earlier about how you got started with 5G and how this project got started. And I wonder if there's anything from that experience and your current experience that you can share for others, other healthcare organizations, technology companies, the wireless industry. What are some of the ways in which these three groups can work together most effectively to deliver the sorts of advances that you've been talking about? What are maybe some of the lessons learned that you can share with others?
The way I see the world in this space is, it's so exciting because we have probably the biggest challenges in healthcare, at least in the scope, that we've ever had before. I mean, we have a growing older population with multiple comorbidities. We have staggering healthcare costs, $3 trillion a year, 20% of our GDP, and we don't have enough providers to take care of all those people if we could afford it, which we can't. And so the legacy way of taking care of people is not sustainable. We need a paradigm shift about how we do this care. And so we know that we can't continue on this path successfully, or at least it seems apparent to me. But at the same time, technology is rapidly expanding and increasing in ways that could potentially solve those problems. But we're not going to solve it if we just throw technology at the problem. Technology for technology's sake, even great technology, is not going to solve the problem. Healthcare and everything about it is exceedingly complex, and there's a lot of people with good intent that, if they don't know and understand all the different components, will not be able to be successful. We can do great harm with good intent, and it takes just as long to create the wrong solution as the right one. So we need to come together. We can't work in silos, and we need translators. We need people who can work at that intersection. Nobody needs to know or can know everything, but we need to work in ways and understand that everyone brings specific value, knowledge, expertise that is an integral part of coming together. So that is key and critical for us to come together and to understand where everybody fits in and can help each other, and to maybe have the humility that we don't know everything, and we need to work with others who do, and complement each other's skills. So if we have those components, if we have people who are engaged and passionate about solving these problems, but also understand that we need to do this together in ways that are effective and collaborative, that's when we are going to be really successful.
That's great. Thank you. And thank you so much for sharing your thoughts with us. Thank you so much for taking the time. I really appreciate it.
Thank you, Nick. And a big thank you again to all of our speakers for participating in today's event. If you missed a part of the program, or you would like to share it with a colleague, the webinar will be available on demand on our website at ctia.org. You can also stay up to date on all the latest content and use cases from our Building the 5G Economy series, including the next installment of this webinar series, on our website or by following us on Twitter at CTIA. Thank you for tuning in. We'll see you next time.